Blooms Network, Sujitra facility.
This is Jerome Edwin, Occupational Therapist from Pinnacle Blooms Network, Sujitra facility.
Today we are going to talk about management of fluency disorders in children and adults. So fluency is the major component. As I said, today we are going to talk about management of fluency disorder in children and adults. So fluency is a major component that we all notice when we communicate with someone. So before moving into the what are fluency disorders, the management of fluency disorders, I would like to talk about fluency. So fluency is something like if the speech is very smooth or if it is flowing easily without any disruptions, we call it a fluent speech. So there are components like continuity, rhythm, rate, and effort. For a fluent speech to occur, it should be properly with proper effort. The rhythm should be proper, and the rate should not be more. For example, it can be slow or like if someone is talking the speech, sometimes it will be very slow or sometimes it will be very fast. So there should be moderate rate of speech, and also there should be continuity. Okay, so when there is a disfluent speech, there will be the lacking components like there will not be any kind of continuity, rate, rhythm, and effort will also be not proper. So, whenever there is disruptions in speech, whenever there is word finding difficulty, whenever there is any behavioral characteristics, abnormal behavioral characteristic that we are noticing, or there is any groping errors, we say that the speech is disfluent. So, when we talk about fluency disorders, there are different fluency disorders. It's like normal non-fluency, and in stuttering also we have many different types of stuttering like neurogenic stuttering, developmental stuttering, and the psychogenic stuttering. And apart from all these things, without any disruptions or something, we have cluttering also. But today we will be focusing on normal non-fluency and stuttering. So, what is normal non-fluency? Normal non-fluency is something that we see in a child. So, for example, it can be seen in a child with in the age range between 2 to 7 years, most probably from 2.5 to 4 years of age. So, in this one, the child will be exhibiting characters like interjections, using lot of those kind of sounds or any kind of repetitions, prolongations. But these kind of things will be happening without the awareness of the child. The child will be never be aware of the situation that the child is going to any kind of speech disruptions, and the body movement will be fine, and child will continue to speak, and there will not be any kind of disruptions in this in their speech. And these kind of repetitions or the disruptions usually fade or usually decline through their age. So, so normal non-fluency is something that we can see recovery after few years, a few months of age. So, but when only in few children whoever is having like put under like extreme condition with parental stress and those kind of things, they it can change to stuttering. So stuttering can start with normal non-fluency, but when there is any abnormal environmental conditions, then it can change to stuttering. So when we talk about stuttering again I said that like stuttering is when there is like more efforts in speech, and will be with more disruptions. There will be lot of pauses, blocks in speech, then we call it stuttering. Stuttering, we can study stuttering and we can learn stuttering by learning their core behaviors. Like when we talk about the core behaviors of the stuttering, we can see lot of repetitions. Repetitions as in like there will be any kind, if the person with stuttering is trying to say something, there will be a repetition of the same word again and again, or the repetition of the syllable again and again, and there will be kind of prolonged speech. They will try to prolong the speech and then talk, or there will be blocks in between the speech. When they are putting up a sentence, we can see any kind of blocks within within the word or between the words. So when we find these kind of core behaviors in a person, we can say that the person is might be having stuttering. Or the secondary behaviors like we can see a lot of speech musculature movements like head movements, nodding, keeping this neck stiff, and moving the extremities a lot. So in order to escape from the situation, in order to cope up with the situation, the person with stuttering may be showing all these kind of secondary behaviors. Apart from the secondary behaviors, we can also see some avoidance behaviors and the escape behaviors. In avoidance behavior, we might say that the person will try to avoid a situation. He might be knowing that when I go into this particular situation, I might stutter there. So what happens there? Usually the person with stuttering will try to avoid that situation and escape from a particular situation. For example, sometimes for example, if we say if a male is trying to talk to a female, so what happens there? They might feel it more. They may stutter more. Or if a person is trying to talk to their elders or trying to talk in a public place, we usually have problem when we talk in public places, but they will be having more of disfluent speech or more of disruptions, repetition, prolongations, or blocks in the public places. So next are the feelings and attitude, how they feel and what will be their attitude towards it. So when we say the feelings and attitude, they might feel guilt about they are not able to correct their speech. They might feel ashamed to talk in front of others, and they might not have confidence to talk. Lack of confidence can be seen. So they might be scared to face the situations. So these kind of problems we can see easily in persons with stuttering. So when to seek the help of SLP? So when what happens there? So whenever we find someone, a kid or someone who's having already having the family history of stuttering, or the person is in front of the person who's already having stuttering, or their severity is increasing, and then there is a problem in speech. So these kind of whenever we find all these things, we can seek a help of SLP. So in management, where we start is that like we'll first find the problem with the child. We through the proper assessment, we have to see where are the places the person with stuttering is having problem, and where like what kind of secondary behaviors they are showing, and these all should be controlled in the therapy. So there are different types of approaches that we have. First, let's talk about indirect therapy approach. So usually when a child is not aware of the situation that the child is stuttering, we go with the indirect therapy technique. This is usually done by the parents. So in the indirect therapy technique, what happens is that the parent will try to improve the situations or improve the environmental conditions or alter the environment of the child, so that the child is not going to stutter, or it will reduce the disfluencies of the child. But this will be done with the help of SLP. So here what happens, the child will be in a more natural situation and try to control their stuttering. And in indirect condition, the child will be well aware of the condition that the child is stuttering, and the child will also be having secondary behaviors. So in this condition, what happens is that a therapist will like mainly this will be done by a therapist. The therapist will control the stuttering of the child or alter the situation by using play drill therapies, or using any kind of fluency shaping therapy, stuttering modification therapy, and self modeling therapy. These kind of therapies can be used in the indirect therapy techniques. And when we talk about, and the third technique can be the interaction therapy techniques. In interaction therapy techniques, the parent directness will not be there. Parent will not be included in the therapy. Child's attention is more important in the therapy. And what happens is that child will be more physically involved in a play when we go with this interaction therapies. Questioning to the child should be reduced, and length of utterance, what the child is talking, the length of utterance should also be reduced, and linguistic complexity should also be reduced. And the child will be given more of language inputs and more reinforcement, so that the child will try to reduce the stuttering conditions. And one more thing, what we all have to notice here, that when we see normal non-fluency, the child is having normal non-fluencies, we should always, like a parent should always put not pressurize the kid or put him in a stress, so that this is going to become a stuttering. So whenever the child is having any kind of disfluency between 2 to 4, this is going to be quite normal, and the child will recover from that. So there is no need of correcting the child will recover from it. So what should we do when the age crosses, or when we find that the stuttering is still continuing? You can seek the help of a therapist. And next we are going to talk about um, stuttering modification therapy. In stuttering modification therapy techniques, we have medverse. In that medverse, we'll say that we are going to motivate the person with therapist, identify where the person is stuttering, and then we are going to desensitize all the situations, and then vary the situations, approximate and stabilize. In this one, we'll say, for example, we have cancellation techniques. In this cancellation, the person will have tension. It's like we are going to modify the tension of the person in such a way that the whenever this is going to happen, in the like whether the stuttering would have happened earlier, and the patient is going to cancel the stuttering and the upcoming situation. And then pull out techniques, this is going to occur when the modifying the tension during the stuttering situation. And in preparatory set, the person with stuttering is going to get prepared and going to control their attention when he anticipates of stuttering. This is medverse. In stuttering modification technique, what happens is that we all know that stuttering is involuntary. We are going to control or bring it to our control. This can be done using a kind of, we can also use a reading or talking to the person, conversating or talking about the episodes, knowing something, and those kind of things can be used. So whenever the client, the person who's stuttering is talking or trying to talk something, the person with stuttering will given the idea that he is going to stutter, or he has to process what he has to say and stop whenever he stutters and say repeat the word again. And next is the fluency shaping therapy. This is going to be quite of very normal and normal stuttering. So what we are going to do is that naturally stopping the stuttering. In this one, we will be using prolongation techniques, airflow techniques, or both. In prolongation techniques, what happens is that the patient will be asked to prolong a word before saying it, so that it will allow the patient with stuttering to process the word what he has to say, and then prepare for it and then execute it. And in airflow techniques, we know that monitoring their breathing will be given, or these can be done in both the conditions. And next is the as I told that we have fix we have improving gesture therapies. In the improving gestures, what happens is that we are going to use six gestures, six steps will be there. We are going to improve the breathing, articulation, and then voice. So here in this one, we are going to ask the person with stuttering to monitor and then control the loudness and articulate with light efforts, and inhale and then talk slowly, and those kind of steps will be given to the person with stuttering in improving gestures. And next is the behavioral modification. What are kind of behavioral therapy approaches that we can give in for this person with stuttering is that first one is to increase or promote the desired behavior, or to reduce or eliminate the undesired behavior. For that, we have to use a kind of reinforcement. So in this one, we have positive reinforcement, negative reinforcement, reinforces and punishments. And this positive reinforcements are going to improve the desired behavior. Negative reinforcement will reduce the desired undesired behavior, and reinforcers are the events or the objects that will be given to improve the frequency of the occurrences. And then punishment, the person with stuttering is never going to have any kind of episodes. He is going to stop it. He is going to understand that there is a disfluency, so I have to stop it. These kind of punishments will be given. Any kind of a shock therapy kind of punishments will be given. So in reinforcers also we have biological reinforcers. So these biological reinforcers can be a kind of food that is given to eat or any kind of tokens things. And in secondary reinforcers, it can be like appreciation, clapping, tapping, and those kind of things can be given in the secondary reinforcers. So when to provide a reinforcement? So these kind of reinforcements, positive reinforcement will be given whenever they are going without stuttering. These kind of positive reinforcements can be given to the kid, and it should not be every time continuous, and it should not it should be it can also be intermittent. So every time when we are going to present a reinforcement, we should be well aware when to provide the reinforcement. Whenever we provide a reinforcement without any reason, it will not be so appealing for the person with stuttering. And next is a timeout, or taking away any kind of tokens or that we have already given to the person with stuttering. Next is that we are going to talk about, we have many instrumental, mechanical, and electronical approaches to reduce the stuttering. And in this one, what is going to happen is that we will be trying to alter the speech. That is like altered auditory feedback. In this one, the person with stuttering, whenever he is speaking, his speech will be altered electronically, and then he will hear the altered speech, and there will be reduction in the episodes of stuttering. And it can also be masked altered speech, auditory feedback. In masked auditory feedback, what will happen is that the a person with stuttering will be given noise through the headphones, so that the person is going to correct whenever there is stuttering episodes. And in other thing is the delayed auditory feedback. Whatever the person with stuttering is speaking, he will be hearing it through a headphone with a delay of 200 milliseconds. Apart from all these things, we can also do many other techniques to involve the child more into the therapy. It's like we have lily pad technique, barrel bridge analogy, we call it. So in this one, these the client or child will be pretending like a frog. For example, the frog, whenever the frog is landing on a lily pad, the child has to say a word. So, whenever the child is going to present or going to produce a word, it's like bat, the child has to say. We'll have three lily pads on it. The child will be moving from one to another without any disruption. But if there is any stuttering episodes, disfluency occurring, the frog is not going to move. The frog is not going to reach the other string. The frog will be directly continuously jumping on the same lily pad. So it means that the child is stuttering. The child had to correct himself or herself. So this will give a proper feedback of stuttering. In next one is the finger analogy. In finger analogy, we will be using a finger, and thumb will be acting as a tongue, and then the fingers will be acting as the letter of a word. So whenever the child is talking smoothly, the fingers will move towards the thumb, and the child will be able to speak with fluently. So if the child is speaking fluently, the finger will move towards the thumb. But if there is any kind of blocks or any kind of repetitions, the finger is going to stick to this thumb for a longer time, or it's going to give a stress kind of thing, like on the thumb. So it means that there is a disfluency, that the child has to control the disfluency. Other techniques are like shadowing. In shadowing, what happens is that the therapist is going to use a kind of any kind of reading techniques or any reading books. The therapist will be reading a book, and the person with stuttering is going to follow the therapist. So what happens here is that whatever the therapist is trying to say, the person with stuttering is going to follow it. So this will also reduce the episodes of stuttering. So again, in this one, there is a problem. So whenever we use the same material or same storybook again and again, the person with stuttering is going to get adapted to the material, and there will be the person might not stutter. So there is a variation needed so that it will give a different exposure to the person with stuttering. And next is the modeling. In modeling, what happens is that the therapist is going to model the situations where the therapist is going to stutter and what they have to do to control it. So, in modeling is going to help the person with stuttering to control their stuttering episodes or the situations. Apart from this, we can also use tapping techniques. In tapping techniques, this is mainly going to help the person with stuttering to reduce the rate of speech. Whenever he tap one, the person with stuttering has to say a letter, say a word, and then second tap, next word, third taps, next word. Like that, they have to go. This will help the person with stuttering to reduce the rate of speech. So mainly we'll ask them to talk slowly so that they will get time to process the word what they have to say, and the brain will be able to process it and then execute it. And next is the humming technique. In humming technique, what happens is that the person with stuttering will be asked to hum before starting a word. So this will allow the brain to process what they have to say. So whenever he is going to start up with the word, he is going to start it with a humming. So this humming is very helpful whenever the person with stuttering is having a initiation problem. Next is other airflow techniques. In airflow techniques, what happens is that the person was stuttering is going to monitor his breathing pattern. So here mainly what happens is that we will first ask the person with stuttering to keep hand on their stomach and observe their breathing pattern. First, process what they have to say in the brain, and then take a deep breath inside. And while talking, they have to slowly leave the breath and then talk. So this is going to help them to control the episodes of stuttering. And these are the techniques again used by the speech language pathologists. And apart from that, we can also seek the help of behavioral therapists when there is any need of any problem with the behaviors. For example, avoiding the situation kind of things. So this is all about the management of stuttering or like a fluency disorder in children and adults. If you have any questions, you can ask them in the comment section. Do we have any questions?
Not yet.
So we are winding up with the session. If you have any questions, you can give in the comment section. Thank you.